If you reach for a heating pad the moment your arthritic knee flares up and swells, you might think you are comforting the joint. You might feel that warm, soothing sensation and believe you are doing the right thing. But biologically, you aren't helping it. You might actually be pumping more fluid right into a joint capsule that is desperately trying to drain it out. Hello, I'm Dr. Marcus, a doctor of physical therapy specializing in geriatric orthopedics and joint biomechanics. In my clinic, the number one question I get isn't about risky surgeries, joint replacements, or complex pain medications. It's simply, Dr. Marcus, should I use ice or heat? It sounds like such a basic question. But getting this simple choice wrong is a silent mistake that is keeping millions of seniors in unnecessary pain. It actively stalls healing, worsens inflammation, prolongs muscle spasms, and drives thousands of unnecessary doctor visits every single year. By the end of this video, I am going to give you a foolproof, medically sound ice versus heat cheat sheet. You will know exactly which temperature to apply for morning stiffness, sudden arthritis flare-ups, and post-activity swelling. You'll understand exactly how to manage these symptoms safely, allowing you to instantly speed up your recovery and take control of your pain right at home. But before we dive into the biology of your joints and how they react to temperature, let me ask you a quick question. Which do you usually reach for first when your joints hurt, ice or heat? Let me know down in the comments right now. I'm always curious to see what my viewers default to, because the answers usually surprise me. To understand why this choice is so critical, let's talk about a patient of mine. Let's call her Helen. Helen is a 68-year-old retired school teacher living in Grand Rapids, Michigan. She is fiercely independent, lives alone, and absolutely loves tending to her backyard garden. But last spring, Helen came into my clinic on the verge of tears, leaning heavily on a cane, convinced that she finally needed a total knee replacement. She was terrified of losing her independence. She sat on my exam table and told me, Dr. Marcus, I spent 3 hours pulling weeds on Saturday. It was the first nice day of the year. My knee started aching a bit, so I came inside, sat in my recliner, and wrapped my favorite heavy heating pad around my knee on the highest setting for an hour to soothe it. But instead of getting better, by dinner time, my knee looked like a balloon. It was throbbing. It was hot to the touch, and the pain was so sharp I couldn't even bend it to walk up the stairs to go to bed. Helen thought her joint had finally given out. She thought the bone-on-bone friction had destroyed whatever cartilage she had left. But when I examined her knee, her ligaments were perfectly stable. Her x-rays showed normal signs of osteoarthritis for a 68-year-old, but nothing that warranted this sudden, agonizing ballooning of the joint. The primary culprit for her intense, throbbing pain wasn't a sudden mechanical failure of her knee. The culprit was the heating pad. What Helen did is the exact mistake I see every single week in my clinic. Let me explain what is happening biologically inside your joints when you do this, because this is where the confusion lies. As we age, the cartilage in our joints naturally thins out. It loses some of its water content and shock-absorbing capabilities. When you overwork a joint with existing arthritis, like Helen did by repeatedly kneeling, standing, and squatting in her garden, the tissues inside that joint experience microtrauma. Your body is incredibly smart. It responds to this sudden mechanical stress by triggering an acute inflammatory cascade. It immediately sends white blood cells, healing proteins, and excess fluid to the area to protect the joint from further damage. That is why your knee or ankle or lower back gets visibly swollen, red, and warm to the touch. That fluid acts like a biological cast, creating pressure to restrict your movement so you don't injure the joint further while it tries to heal. Now think about what applying heat does to the human body. Heat causes a physiological process called vasodilation. This means it opens up your blood vessels. It makes them wider, increasing the volume and speed of blood flow to the area. When you have a chronic, tight, stiff muscle, vasodilation is a wonderful thing. It brings fresh blood, oxygen, and nutrients to starved, rigid tissues. But what happens when you apply high, sustained heat to a joint that is already acutely inflamed, actively irritated on a microscopic level, and flooded with excess protective fluid? You are essentially opening the floodgates. You are artificially widening the blood vessels and pumping even more fluid into a closed joint capsule that has absolutely nowhere to put it. It's like turning a fire hose on full blast into a tiny water balloon that is already stretched to its absolute limit. That excess fluid builds up immense internal pressure. Inside your joint capsule, you have thousands of tiny, highly sensitive nerve endings called mechanoreceptors and nociceptors. When the fluid pressure skyrockets, because you used a heating pad on a fresh flare-up, those nerve endings get crushed against the joint lining. That crushing pressure sends screaming, throbbing pain signals straight to your brain. Helen wasn't feeling the pain of bone-on-bone friction in that recliner. She was feeling the agonizing pressure of a localized flood inside her knee capsule, a flood she accidentally made dramatically worse by choosing the wrong temperature therapy. Understanding this simple mechanism, that heat expands vessels and draws fluid in, while ice constricts vessels and pushes fluid out, is the absolute first step in taking control of your joint health. If your joint is suddenly swollen, hot to the touch, or sharply painful after a specific activity, heat is your enemy. But, as we're about to see, the exact opposite mistake is just as common. While Helen pumped fluid into her swollen knee, many seniors are doing the reverse, using ice to freeze their muscles into agonizing rigid spasms, making them wake up feeling like their spine is made of solid concrete. Let me introduce you to Robert. Robert is a 71-year-old former auto mechanic from Dayton, Ohio. After 40 years of bending over engine blocks, Robert's lower back is predictably stiff, especially first thing in the morning. He has been diagnosed with degenerative disc disease and mild lumbar osteoarthritis. Robert heard somewhere along the line that ice is good for joint pain because it fights inflammation. So, every morning at 7 a.m., Robert would shuffle into his kitchen, grab a gel ice pack from the freezer, sit in his armchair, and press that freezing pack firmly against his stiff lower spine for 20 minutes. And every single morning, Robert wondered why it took him until noon just to be able to stand up completely straight. He thought his spine was rapidly deteriorating. He thought he was headed straight for a risky spinal fusion surgery. But just like Helen, Robert's spine wasn't failing him. He was just applying the wrong biological tool at the exact wrong time. When you apply ice to the human body, it triggers vasoconstriction. The blood vessels shrink and narrow. The blood flow to that specific area dramatically slows down. If you have a freshly sprained ankle that is pooling with blood and excess fluid, this is exactly what you want. You want to restrict that flow. But what is actually happening in Robert's back when he wakes up? When you sleep, you are stationary for hours. The synovial fluid inside your joints thickens up, much like motor oil does when an engine sits in the cold. Furthermore, Robert's lower back muscles are already chronically tight, holding onto tension to protect his aging spine. Those tight, stiff muscles are desperately craving oxygen, nutrients, and warmth so they can physically relax and elongate. When Robert slaps a freezing ice pack on an already tight, oxygen-starved muscle, the body panics. The sudden cold causes an involuntary reflex called muscle guarding. The muscles forcefully contract and lock down to protect the core temperature of the spine. Robert was literally freezing his muscles into a state of rigid, agonizing spasm. He didn't need a spinal fusion. He needed blood flow. The moment we swapped Robert's morning ice pack for a warm, moist heating pad, his morning stiffness vanished by 7:30 a.m. He was able to stand up straight, take his dog for a walk, and get his life back, all because he stopped fighting his body's natural biology. So, how do you know exactly when to act like Helen should have and when to act like Robert? In my clinic, I give my patients what I call the ice versus heat master cheat sheet. I want you to memorize these rules because they will save you hours of unnecessary pain. Rule number 1. The swelling and sharp pain rule. Use ice. If your joint pain is new, if it started after a specific activity, like Helen in her garden, if the joint feels warm to the touch, or if it is visibly swollen and puffy, you must use ice. People often think, but ice is uncomfortable. Yes, it can be, but you are using it as a biological tool to restrict blood vessels and push that painful, throbbing fluid out of the joint space. Ice is for acute flare-ups. Rule number 2, the morning stiffness and aching rule. Use heat. If your joint pain feels like a deep, dull ache, if it is worse first thing in the morning, or if the primary feeling is that the joint is simply stuck or tight, you must use heat. You need vasodilation. You need to open those blood vessels, bring fresh oxygen to the surrounding muscles, and warm up the synovial fluid inside the joint so it can lubricate the cartilage. Heat is for chronic stiffness. Rule number 3, the movement rule. Never use heat immediately after a long walk, a workout, or a heavy day of yard work, even if the joint aches. Activity naturally increases blood flow and microscopic inflammation. Applying heat right after activity compounds that swelling. Always cool down with ice if a joint hurts after moving. Save the heat for before you move to warm the joint up. Rule number 4, the contrast therapy secret. What if your joint is a little swollen, but the muscles around it are incredibly stiff? This is where physical therapists use a secret called contrast therapy. You alternate. You apply heat for 10 minutes to bring fresh, nutrient-rich blood into the area and relax the muscles. Then you immediately switch to ice for 10 minutes to flush out the old, stagnant fluid. The pumping action of the blood vessels opening and closing acts like a vacuum, clearing out inflammation while keeping the muscles loose. If you take nothing else away from this video, I want you to write down this one specific question. At your next doctor's appointment or your next physical therapy evaluation, do not just say, "My knee hurts." Ask your doctor this exact phrase. Is my current joint pain driven by active inflammation or mechanical stiffness? If your doctor says it's active inflammation, you are in an ice phase. If they say it's mechanical stiffness or muscular tension, you are in a heat phase. Knowing the answer to that single question dictates your entire at-home recovery strategy. But even if you choose the right temperature, there is still a massive safety trap that seniors fall into every day. Aging skin and neuropathy change the rules for how long you can safely apply temperature therapy. If you leave that heating pad on for too long, or put that ice pack directly on your skin, you can trigger a rebound effect that causes massive tissue damage without you even feeling it. The biggest hazard I see with temperature therapy isn't just picking the wrong one, it's leaving it on for too long. When we are in pain, human nature tells us that if a little bit feels good, a lot must be a cure. I have had patients fall asleep with heating pads on their lower backs, and others who strap bags of frozen peas to their knees and leave them there for an hour while watching television. If you do this, especially as you get older, you are putting your skin and your underlying tissues at serious risk. Here is the golden rule in my clinic: 15 to 20 minutes. That is your maximum window for both ice and heat. Let's look at ice first. If you leave an ice pack on a swollen joint for more than 20 minutes, your body actually overrides the vasoconstriction. It senses that the tissue is getting too cold, and to prevent frostbite, it triggers a sudden, massive rush of blood back to the area to warm it up. This is a biological defense mechanism called the hunting response. So by leaving the ice on for 45 minutes, you actually cause the exact vasodilation and swelling you were trying to prevent in the first place. You completely reverse the benefit. With heat, the danger is tissue damage. As we age, our skin naturally thins out. We also lose some of the superficial nerve sensitivity that warns us when something is getting dangerously hot. Conditions like neuropathy or poor circulation can make this even worse. If you leave a heating pad on high for an hour or fall asleep with one, you can easily cause deep tissue burns without even realizing it until the damage is already done. This brings me to the second non-negotiable rule, the barrier method. You must never, under any circumstances, place a chemical ice pack, a frozen bag of vegetables, or an electric heating pad directly against your bare skin. Always, always use a barrier. Wrap the ice pack in a thin dish towel. Wear a thick long-sleeve shirt or sweatpants under the heating pad. You want the temperature to penetrate the muscle, but you do not want it directly assaulting your epidermis. And finally, you must know when to stop. Temperature therapy is a wonderful symptom management tool, but it is not a cure for a severe acute injury. If your joint is suddenly hot, red and swollen, and applying ice for a few days does absolutely nothing to bring that swelling down, or if the pain is accompanied by a fever or an inability to put any weight on the limb, you stop. You do not try to outstubborn it at home. That is when you need to be evaluated by a medical professional to rule out an infection, a tear, or a fracture. I want you to think back to Helen, our gardener in Grand Rapids. We completely overhauled how she handled her knee pain. We didn't stop her from gardening. That would have broken her heart and robbed her of her daily joy. We just made her biology work for her instead of against her. Now, when Helen wakes up and her knee feels a bit stiff, she uses her heating pad for 15 minutes before she goes outside. That opens up her blood vessels, warms up her synovial fluid, and gets the joint lubricated for the mechanical work ahead. Then, she goes out and works in her garden. But when she comes back inside, the heating pad stays in the closet. Her joint has just done a lot of mechanical work and is experiencing microscopic inflammation. So she elevates her leg, wraps an ice pack in a towel, and places it on her knee for exactly 15 minutes to push that inflammatory fluid right out. Helen hasn't been back to my clinic in 6 months. Her knee hasn't ballooned up since that day. She didn't need a joint replacement, and she didn't need to give up her independence. She just needed to stop making the silent mistake of pouring heat onto a fresh fire. You have the power to manage so much of your daily joint pain right at home, simply by understanding how your body reacts to the tools you give it. Now, I want to hear from you. Which step are you going to take next? Comment starting today. If you're going to use this temperature cheat sheet and strictly follow the 15-minute rule, comment asking my doctor if you're going to ask your provider if your pain is driven by active inflammation or mechanical stiffness at your next visit. And please comment sending this if you know a spouse, a sibling, or a friend who constantly misuses their heating pad or ice pack, and share this video with them right now. It could save them from weeks of unnecessary pain. If you found this helpful, make sure to save this video so you can reference the cheat sheet later, and hit that subscribe button so we can keep your joints healthy, moving, and pain-free for years to come. I'm Dr. Marcus, and I'll see you in the next video.